Hi, I'm Dr. Denny, owner of the San Francisco Spine Pain Relief Center at Denny Chiropractic Corporation. And I'm going to talk about what happens when you're in an auto accident. And hopefully I'm going to save you a lot of pain, time, and trouble with what you're going to learn on this videotape. Okay, so first of all, let's just say you're in an auto accident, and the most common one is the rear ender. Right? And there's no mystery whose fault that is. You know, it's very clear cut. It's the person who hit you. And everybody at this point in time, what they're going to do is you are going to call the insurance company of the person who hit you. 99% of the time, they're going to be very nice to you on the phone, and they're going to say, don't worry about it, we'll take care of your bills. Okay, and they're saying that because they don't want you to get an attorney, right? Keep in mind, they're called insurance companies, not insurance nonprofits, right? And the way insurance companies make money is to collect money for premiums and pay out as little as possible for claims. Believe that. They're being nice to you because they want you to believe that it's going to be a quick and easy process. They're going to pay all your bills and you don't need an attorney. So I have dealt with many of these cases as a healthcare provider, lots of personal injury attorneys, lots of people who have been in auto accidents, and lots of insurance companies. And let me tell you this, unless it is the most minor of accidents, just take a little scratch on your fender and you're not hurt at all, you need an attorney. And the reason people are hesitant to get a personal injury attorney, I think, is because of two reasons. First of all, they think it's going to cost them money. But let me tell you, you're actually going to get more money for your accident and have it save you time and trouble with an attorney versus going against an insurance company without an attorney. I think the other reason that people are hesitant is because maybe they have a bad image of personal injury attorneys, like they're ambulance chasers. And hey, you know, there's a few bad apples in every profession, but all the attorneys I work with, and we have like 3 or 4 that we like to refer people to, they work at different firms, they all have the highest integrity. And they're really honest people, and they're going to tell you, they'll give you a free consultation, and they're going to tell you right off the bat, yes, you need me, or no, you don't need me, and these are the things you should say and the way you should document your case to deal with the insurance company. Okay, so let's go on to, say you start this process without an attorney, what's really going to happen? So, the insurance company tells you, don't worry, we're going to pay your bills. And 100% of the time, people think that the insurance company is actually going to pay the healthcare provider directly. So let's say you're in a bad accident. This actually happened to a couple patients of mine. They're on the highway. They're going 70 miles an hour on Highway 101. All of a sudden, traffic comes to a stop. Well, they're paying attention, so they stop in time. And they look in their rearview mirror, and they notice the car behind them. The guy's actually leaning over, kissing somebody, and not paying attention, and plows into the back of their car, going that fast, 65 to 70 miles an hour. You can imagine that my patients were hurt pretty bad, and their car was completely totaled. So they were taken to the emergency room, and then subsequently, they had chiropractic care. Okay, so you're hurt, you go to the emergency room, you get chiropractic care. Now, in the patient's mind, they're thinking the insurance company is going to pay the healthcare provider, but that's not how it works, at least in the state of California. And it doesn't matter who this is, doesn't matter if it's General Hospital or the top surgeon in town. The insurance company never pays the healthcare provider directly. This does not exist. You have to get the money from the insurance company to try to pay your bills here. Now, what's the problem with that? Now you've got to try to get the money from the insurance company. Well, there's a few problems with that. First of all, you have already received and rung up bills with healthcare providers. And they're waiting to get paid, and they don't care whose fault the accident was. They provided you with that service, and you owe them the money for that service. Okay, so let's just say 6 months, 8 months down the line, you're done treating, okay? You've seen the chiropractor or whatever, and now you have to try to get the money for your bills. By the way, the emergency room is not going to wait. They're going to send you into collections, and they're going to be aggressively trying to pursue you for that money, whether or not you've gotten the money from the insurance company. So let's just say you've racked up, $10,000 worth of bills just between your emergency room, you've gotten some chiropractic care. Let's say you've missed a few days off work because you were hurt. This is actually happening to a friend of mine right now who's a hairdresser who was hit in a crosswalk in San Francisco. She did not get an attorney. She was hurt. She racked up a bunch of bills. She missed a bunch of days off work because she couldn't stand all day. And now she's trying to get the money from the insurance company. And guess what? Mr. Nice Guy Insurance Company, who was so nice with you that first day, they're saying, we don't think that you racked up $10,000 worth of bills. We want to give you $3,000. Now, what are you going to do? Right? It's you're going to go against the insurance company. It's like David and Goliath, except in this case, David's not going to win the battle. All right? You are no match for the insurance company. Now, they're telling you, we're not going to give you enough to pay your bills. And what are you going to do? You're stuck here. Now, let's just say you went with an attorney, a three-legged attorney. So the attorney acts as a bridge, okay? They're going to sign a lien with your healthcare providers. They're going to contact the insurance company and tell them, you know, they are handling the case now. So that insurance company will not call you and try to engage you in a conversation, which they're going to try to get you to say things that they're going to use against you later on to defend why they're not going to give you that money. I've seen it happen time and time again. Most of all, you do not have to deal with the insurance company at all. Your attorney is going to deal with the insurance company. The attorney is going to get you that money. The attorney is going to make sure your healthcare provider is paid, and they're going to make sure that you are paid for the pain and suffering or your time off work. Catch our next episode in this series, which is on MedPay, how to get your own insurance company to pay for your medical bills. This has been Dr. Denny from the San Francisco Spine Pain Relief Center. Much love from San Francisco.